We are joined today with Mr. Patrick Vanderloo, Pfizer's Regional President for the Middle East, Russia and Africa. Thank you, Mr. Patrick, for joining us today. Reflecting on Pfizer's 175 years of history, what do you consider the most significant milestone or achievement for the company?
175 years is very difficult to summarize in just one achievement, but I think there are a couple that I'm really proud of as a company and that you hear coming back over and over again. I think the first one is the mass fermentation of penicillin during World War II. That saved numerous lives and really set the company up for its future success. So I think that's one. Second is really the work that we have done in the field of cancer. When you look at breast cancer treatments that we have brought in over the course of the years and now the work on lorlatinib with lung cancer, I think that's number two. Number three has to be the pandemic and the work that Pfizer did on really the first mass production of any mRNA vaccine as well as a treatment. I think lastly, and that's less related to products and success, is the realization and understanding that in the world that we live in, to get proper access to people that previously did not, so the people in underprivileged communities, has become really a key priority for the organization. So those for me are what I would consider the key achievements of the organization.
What are some of the most critical healthcare challenges which are unique to the MENA region that Pfizer is addressing?
I think the challenges are multifold. One is that there are certain prevalences of conditions and diseases, just more on the continent than there are elsewhere. And part of that is infectious diseases, obviously. Part of that also is certain variants of certain cancers that are very different here in the region than they are, for example, in Europe or in North America. On top of that, I think it's the environment that's very different. We have some of the wealthiest countries in the world in this region and some of the poorest. So how you provide healthcare and how you provide medicines and vaccines to these people is very different from one country and economy to the next. So those would be the key challenges that I would mention.
What role does Pfizer play in supporting local healthcare infrastructure and professional development in the MENA region?
I think we have a number of different roles to play. First of all is access to medicines, so access for patients to medicines. We have patient access programs where more than 15,000 patients are enrolled in over 30 programs across the MENA region. And we have our Accord for a Healthier World, where we make medicines available, low-income country, basically have cost of goods plus distribution, so at a non-for-profit price. But a large portion of that is also providing education to physicians in countries that don't have access the way that physicians in higher income countries do. And then the third is other types of public-private partnerships where we can provide education for underserved communities or otherwise medical professionals, such as, for example, Haya Karima in Egypt, where we serve 4,500 underserved communities through education purposes, but also in high-income countries where we train very differently for high-tech genomic conditions, for example. I would like this region to really be a leader when it comes to ex-US in Pfizer, driving innovation. And that innovation is access to novel medicines, but also a very vibrant healthcare community that can conduct research and development activities for those conditions that are more prevalent here in the region than they are in Europe and North America.
Thank you very much for talking to Medieval Middle East. Thanks a lot, Mr. Patrick.
My pleasure.